This week on Vegas Inc., now that it has the Supreme Court's blessing, employers are weighing the costs of Obamacare. Will it be the job killer Republicans predict, or, as the president insists, will it lower costs in the long run for everybody? We'll ask an expert.
This is Vegas Inc. with Dana Gentry and Jeff Gillen. We're minding your business.
Welcome to this edition of Vegas Inc., your source for the top business news of the week.
From the resources of the Las Vegas Sun, News 3, and Vegas Inc. right now, let's take a look at our top story. Business owners are coming to grips with just what the Supreme Court's ruling on the Affordable Care Act means to them. The big question, will they feel the pinch when their next bill arrives for their corporate coverage?
News 3's Paul Matadine has been looking into that question. He talked with an expert who says the short answer, yes. Costs will come down for higher risk patients, some of whom will get insurance for the first time, but there's a cost and it's likely to increase for the rest of us.
When it comes down to it, the reason Larry Harrison says we'll likely pay more for health insurance given this law can be explained by this simple logic.
If a young person can buy a health insurance policy today for $100, which they can, and a sick older person buys a policy and their premium is $700, that's a 7-to-1 ratio. In the Patient Protection Affordable Care Act, it says the ratios cannot be more than 3-to-1.
And therein lies the cost. Harrison explaining what that ratio means.
That means the young, healthy people are going to be paying $200, and the maximum that the older person can pay is $600. So the young healthies will be subsidizing the sick old.
And for you, that likely means you'll have to pay more out of pocket to pick up for some people, paying less. Harrison says, however, that employers can help reduce costs by implementing wellness programs and offering more tailored options to employees. A qualified insurance broker, the key to making the right moves. We also met Brad Lee with the local business Lightspeed VT. He expects both his business and employees will soon have to pay up.
I mean, if the premiums went too much, absolutely they're going to be affected because I'm only paying so much.
Quite optimistically, though, he plans to use this challenge as a way to promote growth within his company. The rising costs, motivation for everyone to step things up.
If they increase by 30% and your profits increase by 50%, you're still up a net 20%.
And that is Paul Matadine reporting. Now, the argument on the other side is more people on the insurance rolls will spread out the risk and eventually lower costs, and that people will get treatment earlier when care is generally less expensive. Insurance companies will get more customers, and because of that, mandate for everybody to get covered after 2014. If somebody chooses not to, they face a penalty starting at $285 per family by 2016. That penalty spikes as high as $2,085, depending on your income. In 2014, it will be illegal for insurance companies to use a pre-existing condition to exclude, limit, or set extremely high rates on coverage.
And small business owners with more than 50 employees will have to provide insurance for their workers. And joining us, the man you saw in that story, Larry Harrison from Harrison Insurance Agency. Thanks so much for being here.
You bet. Thank you for having me.
I've got to ask you, the obvious question is, aren't we going to see savings on the other side all around as taxpayers when you don't have so many uninsured people relying on emergency care for their health care needs?
In the perfect world, yes. You know, I like 80% of what I hear out of this bill. I just personally don't like 80% of what it actually shakes out to be. And costs are the problem. Health insurance is, we have the best health insurance in the world. The problem is the cost of health insurance. And health insurance is expensive because health care is expensive. And unfortunately, we're not addressing why health care is expensive. And that is the issue.
How are other nations able to do this and we're not?
Well, a lot of it has to do with how we count. Other nations talk about how their infant mortality is much better than ours. However, we count up for the first 2 years. If their baby is born well, they say that they've had a successful birth, and we count for 2 years. So of course our numbers are going to be much more skewed, and counting is an issue. Canadians have been living a year or two longer than us. 100 years ago they were, and they still are. Why that is, I really don't know. But, you know, we look at the health of the Americans. We have more doctors, more hospitals, more pharmaceuticals today than we did in the 50s.
I've always been baffled by this whole claim that the costs will go up underneath this, or because of this act, for the simple reason that with all of these tens of millions of people coming on who would now be paying premiums and being brought into the health insurance system, how would they not be subsidizing that increase? I mean, wouldn't that mitigate? I'm referring specifically to the whole ratio thing, but wouldn't that mitigate that increase in the long run? And really, small businesses wouldn't be seeing their costs jump in that type of thing because of this.
Well, you know, the idea of insurance is all about spreading the risk amongst the many. So, yes, we have that going on. And you would think that with the individual mandate, now a tax, not a mandate, but guaranteed issue, no pre-existing condition clauses, there's no reason for anybody to buy insurance. Okay? From the insurance company standpoint, and I am a broker, I work for my clients, I do not work for an insurance company. And my job is to improve somebody's benefits, save them money, and keep everybody in compliance with the state and federal laws. So if a person were up on Mount Charleston and hurt, and he had no insurance, he could have his buddies sign up while he's on his way to the hospital. The day the cast comes off, they cancel the policy. Insurance companies are in the business of making a profit, and they cannot make a profit if all they do is pay claims. So we have to have like an open enrollment time.
So even with the penalties that now, the tax, as it were, as the Supreme Court calls it, even with those now in effect, you think that people will essentially cherry pick and just sign up when they absolutely need it?
Well, the penalties of $250 is
and that's per family, right?
Yeah. I mean, the premium is...
but that's only for 2 years, right?
Right. It will eventually go up. But still, when a young person, the young invincibles, those under 30, have a choice of buying the newest, coolest phone or insurance, I know which way they're going to go. I've been in this business for over 23 years. They're going to go for the phone. And now when something happens, they can opt in and opt out. So the fine is not going to be a deterrent. So if we were to say people have an open enrollment, they can enroll in January. And if you don't opt in, well, you're going to have a waiting period until January of next year. Now, there's something that works.
Got it. We are out of time. We appreciate you being here.